Welcome to Medicine A to Z by Dr. Leonard. Today we'll be discussing the treatment guidelines for sinusitis. Before we get started, don't forget to like this video and subscribe to our channel for more medical content. Let's dive right in. From a clinical perspective, sinuses are air-filled spaces lined by respiratory epithelium, which produces mucus to trap particles and prevent infection. This mucus is cleared by ciliary action, with all the sinuses draining into the nasal cavity through small openings called ostia. Before diving into sinusitis, let's understand the anatomy of the sinuses. We have four main sinuses: frontal sinuses above the eyes, maxillary sinuses in the cheekbones, ethmoid sinuses between the eyes, and sphenoid sinuses behind the eyes. Sinusitis refers to the inflammation of the sinus lining, causing blockage and often leading to infection. Sinusitis can be classified as acute, subacute, chronic, or recurrent, depending on the duration and frequency of the episodes. The most common symptoms of sinusitis include nasal congestion, facial pain, thick nasal discharge, headaches, and postnasal drip. Fever may occur in severe cases. On examination, signs may include sinus tenderness, swollen nasal passages, thick nasal discharge, and sometimes fever. The condition begins when the sinuses become inflamed due to viral, bacterial, or fungal infections. This leads to blocked sinus drainage, causing mucus buildup, which then creates an environment for further infection. Sinusitis can result from viral infections such as the common cold, bacterial infections, fungal infections, allergies, and environmental factors like pollution or smoking. To confirm sinusitis, a nasal endoscopy and a sinus CT scan are commonly used. In some cases, MRI or nasal culture may be required. Acute viral rhinosinusitis is a viral infection affecting the sinuses, often following a common cold. Supportive care is essential as there are no treatments that can shorten the illness. While AVRS usually resolves within 10 days, if it doesn't improve after that, bacterial infection could be the cause and should be evaluated. The goal of treatment is to alleviate symptoms such as nasal congestion, fever, and fatigue. Common therapies include over-the-counter medications, saline irrigation, and nasal steroids. For pain and fever, non-steroidal anti-inflammatory drugs or acetaminophen can provide relief. Saline irrigation can help reduce symptoms, but make sure to use sterile water for safety. It's particularly useful for frequent sinus infections. Intranasal steroids reduce inflammation and improve drainage, offering some relief for sinus symptoms. Additional therapies like saline spray and ipratropium bromide can help manage symptoms, while oral decongestants may assist if eustachian tube dysfunction is present. Intranasal decongestants offer temporary relief, but should be used for only 3 days to avoid worsening congestion. Antihistamines may help dry secretions but could cause discomfort, while mucolytics like guaifenesin are used to thin mucus. Inhalation of warm steam can provide temporary relief, but make sure the steam source is clean to avoid infections. The first step in managing ABRS is deciding between observation and antibiotics. For immunocompetent patients, a 7-day observation period with symptomatic management is recommended, as long as follow-up is ensured. Antibiotics are only initiated if the patient's condition worsens or does not improve within this period. When antibiotics are indicated, the first-line therapy is either amoxicillin or amoxicillin clavulanate. High-dose amoxicillin clavulanate is recommended for patients with risk factors like advanced age, recent hospitalization, or comorbidities. For those allergic to penicillin, alternatives include doxycycline or third-generation cephalosporins. Fluoroquinolones are reserved for cases with no other options. Complications of untreated sinusitis may include orbital cellulitis, meningitis, brain abscesses, and chronic sinusitis. Sinusitis is often associated with conditions like allergic rhinitis, asthma, nasal polyps, and, in rare cases, cystic fibrosis or immunodeficiency. Preventive measures include maintaining nasal hygiene, avoiding smoking, using humidifiers, managing allergies, and getting flu vaccinations.
Stay updated with the latest in medicine. Subscribe to our channel for comprehensive videos covering the latest updates in the field.